He's a man on the front lines of Quebec's healthcare system, ER physician Zach Levine. Dr. Zach Levine joins us now. Good morning, Dr. Zach.
Good morning to you.
Thank you so much for the good morning. I appreciate that. Let's talk about patient care because this is a two-way street here. Because as a patient, you want to be greeted, you want to be happy, you want to sort of get the satisfaction that whoever you're seeing you're happy with. Yeah. But it actually doesn't really mean you're going to get good care, does it?
No, that's it. And today is the day, or these are the days of patient satisfaction. And it matters, you know. I think in the past we didn't pay enough attention to patient satisfaction, and doctors kind of maybe did whatever they wanted to do. That's probably not true. That's an overstatement. But basically, it's very important now, patient satisfaction, especially in the States, and especially, you know, online we can rate things. But the interesting thing is when they actually study it, people how satisfied they are with their health care, there's no good correlation between how satisfied they are and how good their health care is.
But do you think that's a risk, you know, when you're a doctor and you're more concerned about that patient being happy, even if it's not the best care? They don't care what the result is. They care more about, did I have a good experience so I can write this on a review site?
Yes. Oh, it's a huge risk. Yeah. It's a huge risk. And hopefully doctors are trained enough and objective enough to give people the proper care regardless of that. But, you know, doctors are human, so it's always in the back of doctors' minds, are the patients going to be satisfied, if they're going to be rated. Doctors, you know, we hate to have complaints against us. You know, we're always worried about doing the wrong thing. And so if a patient has an agenda, so the patient comes in thinking they need the following tests, they need the scan, the MRI, they need an antibiotic, they need morphine, whatever, the doctor feels that pressure. Now, a good doctor will do the right thing regardless. And the very important part of this is communication. The good doctor, and doctors are pressured for time, so they may not do this, but the good doctor will spend the time explaining why you don't necessarily need that and why there's a problem. Because one of the things they have found is that people tend to be more satisfied with more tests and more treatments. But we've talked about this before. More care is not necessarily better care, right? If you do more tests, you're going to find more things that aren't necessarily important. You're going to, and you know, any test has potentially significant risks for it. So you have to be careful what you wish for.
And when you have a serious issue, you're going to end up seeing a lot of physicians throughout the line. We've seen studies that show if something goes wrong, let's say there is a mistake made, something does go wrong with the hospital, a patient will normally blame the doctor that they had the worst relationship with, not the doctor that actually made the mistake. How concerning is that for you as, you know, an ER physician?
Well, I mean, it's certainly always a concern, and we're definitely more and more aware of how important communication is. And yes, definitely some doctors, excellent doctors, are more gruff. You know, and they're more direct and to the point, and they may tell the person, you know, this is, you know, you're wrong, you know, this is not what you need, you don't need any of these tests, you don't need any medications. And it's especially frustrating, I understand. Say you've been waiting in the emergency department 12 hours because you have a mild infection, say a urinary tract infection, and you end up, not a urinary tract infection, you probably will get a prescription for that, but let's say you have a viral illness. You've been waiting all night because, you know, there have been gunshot wounds, there have been heart attacks, you've been waiting, and finally the doctor comes to see you, and the doctor comes in for 10 seconds, hopefully not that short, and they say, you have a cold, fluids. You know, people are frustrated by that. So I think the doctor, the least they can do, and I sometimes do this, you know, it's we start our shift at 8 or 7 in the morning, and people are like, you know, I've been waiting here all night, and the first thing you do is, listen, I'm really sorry, there have been some really sick people, and they couldn't keep up. But the best thing for you, the reason why we're not giving you anything is, if we give you antibiotics, there are side effects to those things. The best thing you can do is just rest, go home, have fluids, that sort of thing.
You mentioned that short 10-second visit, right? And I do know that is frustrating. So is it on the doctor to, no matter what, provide an explanation for the lack of a test or the lack of a prescription, right?
Absolutely, but the patient can help, right? But if you, I mean, in the emergency department it's a bit different, but if you're going to your doctor's appointment, one of the things you can do is prepare, so know what, you know, try and think of the few questions you have, read up about it, make sure to have your medication list and your past medication. And the other thing is you can bring an advocate with you, you know, if you think you're going to forget things, or advocate for yourself, just ask, you know, because if maybe the doctor's in a rush, if you don't understand something, try and remember to ask the doctor.
And you know what? Listen, I do that now for my father. I go with him to these appointments just to be the sort of tag team backup for what he forgets, I'll remember, and vice versa, right? Do patients need to do a better job? Like when you talk to your colleagues, you know, like a patient comes in and they're there for a reason, they show up, and they all of a sudden they forget all these questions that they needed to ask, right?
Yes, and that's, I mean, it's very hard in the emergency department for sure, because there's a lot of emotion involved too, and they've been waiting a long time. But definitely, I think if you have time, if you have an office visit, if you have an appointment, especially if something you've been waiting for, make sure to prepare for it. You know, so have everything ready. Think of the questions you want. Bringing an advocate is a great idea.
Is there now, just quickly now, in the teaching of doctors, when they're going through the university ranks, is there now focus on that kind of communication skills that are needed?
Absolutely. We have that simulation center at McGill. Most teaching places do. And one of the things that we teach, we definitely teach procedures and whatnot, but one of the things we teach is communication. Is how to deal with difficult situations, breaking bad news, and how to just explain things to a patient. Just sitting down, the act of sitting down makes people feel like they have been listened to.
From the front lines to the BT studios, Dr. Zach Levine, thank you so much, ER physician at the MUHC. We'll be right back with your news headlines.